Welcome. Thank you for joining us at this news conference. I'm Dottie Barnes. I will be moderating the news conference and watching our time. I'd like to introduce to you our president, Philomena V. Mantella. She will be offering remarks. And also joining us is Greg Sanyel. He is our vice president for finance and administration. He's also the interim director of our virus action team. So I will let them give a few remarks and we will open it up to questions. Thank you.
Thank you, Dottie. First of all, thank you to all the members of the media for joining us today. As you know, Ottawa County Health Department, with our cooperation, released a staying in place order for our student population on the Allendale campus. The order, I won't go through the order because I know you have the ability to review it and really reserve the time for the media's questions. I'll just turn it over to Greg Sanyel, who's been doing a great job leading our virus action team, for any additional opening comments.
Thank you, President Mantella. Yeah, I would just like to highlight, I think before we get into the questions, that we really feel that our repopulation testing has been going as anticipated. We've seen a leveling off on our cases in the last few days. And we hope that with the coordinated action with the county, that we'll be able to drive our daily case count even lower. We've got a very, like I said, a very aggressive testing program. And we've been very transparent reporting all of our cases, no matter where they are, no matter what county the individual student may be in. And we've been publicly displaying that for some time. And now that the campus has repopulated, we look forward to hopefully better, lower case numbers as a result. So with that, I'll turn it back over to you, Dottie.
Thank you, President Mantella and Greg. So we can open it up for questions now.
I'd just like to highlight, I think before we get into.
Is there a specific way that you guys want to do this, or can we just ask questions?
Yes, go ahead and ask questions. That's the easiest.
Okay, one thing that I was wondering, what is the actual number of cases? I saw in the release it says more than 600, but there wasn't a specific number.
Sure thing, I can take that. Our current caseload, what we're considering our current active cases, is 370. We have 4 faculty cases that are current, 48 on-campus students that are current, 273 off-campus and Ottawa County cases, 25 off-campus and Kent County cases, and 24 off-campus other. Either it's just a different county or we can't identify the county. So that's our current caseload. And what we consider by current caseload, those are the positive cases that within the last 10 days. We've had a total of 740 cases in our entire Grand Valley community since the 1st of August, and that includes all counties.
Could you talk about the enforcement of the stay-home order and how that will be done for students?
Yeah, I think the first step of this stay-at-home order is the notion of the coordinated action, is to work together with Ottawa County and Ottawa County Health Department, as well as our own student life program, and to issue the letter that I just released to the university community that really focuses on the reduced congregation outside of classes and work, and then looks to a more aggressive monitoring program on behalf of the university. We've been monitoring, obviously, our student behavior, but we'll put more sort of students out and about in order to make adjustments to student behaviors if they're forgetting. For example, this order requires students to wear masks outdoors. If a student has failed to do so, to first remind and then move to an action that can lead to repercussions if there is consistent violation of the public health requirements. I would say that the majority of our students are doing a great job following the guidance. So it's really finding those exceptions quickly and addressing them first with education and then with more compliance strategies.
Are there going to be specific repercussions for the violation of the stay-home order? And also, will there be increased patrols by university and county police to enforce that?
I can't speak to the county's posture on this, although we've all been talking about increased monitoring. There will be increased monitoring on the university's part, which will include reminders, student ambassadors, as well as patrolling through public safety. There will be increased patrolling and work on our part, and I expect our partners to do the same. Greg, would you want to add anything?
Sure. I just think that, you know, the real focus of this stay-at-home order from the county is it's not at activities, though, you know, the 100-person events, outdoor events, those large gatherings. Those are really becoming more rare in our community. What we found through contact tracing is a lot of the spread can be attributed to 4 or 5, 6 people just getting together in a room. Just to hang out. And so I think that the idea is, and we talk about getting our numbers from where they are now to driving them even lower. It's really, I think, reminding our students through just peer recognition, peer participation, to be vigilant even in those smaller group settings. I think our students are well aware of the dangers of gathering in a large group, but it's maintaining that vigilance even in those small groups among friends.
This is Tracy Samilton with Michigan Radio. Can you hear me? Not really?
Yes, go ahead, Tracy.
I was wondering about the press release. It says sports are sort of discouraged, but if you're allowing varsity sports, you have to have a position there. Are you currently permitting varsity sports events to happen?
Well, right now, up until the order, yes, the governor's executive order was very specific about the differences between, you know, intercollegiate athletic participation and recreation, and we had just started to begin those practices and conditioning drills. Of course, now we will comply for the next 2 weeks with the county's health order, which was very specific regarding the presence of a doctor at intercollegiate athletic practices.
The order lasts for 14 days. What does the plan look like following that 2-week quarantine period? I know you guys have mentioned more aggressive monitoring. How exactly, what does that look like? Does it mean more daily testing? Are there going to be any changes to the instruction program? Can you guys kind of delve into that a little bit more?
First off, I want to highlight that this is not a quarantine. This is a stay-at-home order from the county health department. It's not a quarantine. And it's very specific about what our students can do. You know, they're still expected to go to class. The university will still be operating as normally. But yeah, we meet regularly with the health department. We've ramped that up to now we'll be meeting daily. Sharing our information. We'll continue to do our testing program. We've got a very aggressive testing program, like I said. You know, the goal of our testing program is to identify people that may be asymptomatic but are positive, and so that we can quickly get them isolated and quarantined as appropriate to reduce the spread. And that's what we've seen since we came back to campus with this aggressive testing program. That's why our numbers have gone up, because we've been very aggressive about it. And when we've seen things like we do a batch of random tests, we see, you know, maybe we've got a particular apartment complex that has a high number, we'll invite the rest of the complex to the next testing. And that's because we want to find these people that are positive and might not know it. Our testing program has a number of factors to it. Of course, we test symptomatic people. Of course, we test people who are asymptomatic that have been exposed to people that have tested positive. And then we also do random tests of our population to find those asymptomatic people that are unaware. We also test people like our RAs, and food service workers, people that are in constant contact. We test those people weekly because we want to find them as quickly as we can before they become before we have more spread. So we will continue with our testing program during this 2-week period. We'll engage with the health department. Like I said, daily. Hopefully we'll see our numbers. They've leveled out. You know, our positivity rate is leveled out and is actually starting to go down slightly, our 7-day average. And we're hoping that we will continue to do that and with our engagement with the health department and go from there. Hopefully we'll be back to normal in accordance with all the governor's executive orders that were in place, that will be in place at that point, and go on from there at the end of this 14 days. Anything you would like to add, President Mantella?
Well, first of all, we're grateful and working with the county and really looking with them deeply on where the issues are and how we can address them, rather than kind of a broad-based order that would put everything at a halt. So we're excited to be able to continue in-person experiential learning, university operations work, and curtail the things that are affecting the spread. I just also want to underscore what Vice President Sanyal said about our testing program. Our testing program is focused on containment. That's the objective. We're going to test as much as we can. We're going to look for hot spots and retest. We're less concerned about how our numbers appear and more concerned that our numbers are doing the job. And so that's really, really important to us. And we think that it's working because it's identifying those issues. We're asking for cooperation from our students. We're adjusting as necessary, whether it is to change the level of online and hybrid or face-to-face overall percentage in our portfolio, or whether it is now to adjust to this period of 2 weeks for more rigor around the kinds of gatherings that Vice President Sanyal has mentioned. So just want to underscore that.
Hi there, Julie from Fox 17 here. Curious, how is it going with students in their cooperation when it goes as far as contact tracing?
Yeah, that's an area that we have more work to do. And I'm glad you raised the question. Thank you for the question. We'd like to see on average the contacts that students share with our health department to look like what is typical of most individuals and in their daily lives. And so we're reinforcing in the message that I sent out that contact tracing is important. It's not punitive. It's just as I was saying with the testing program, it's another element of containing this highly contagious virus.
There was a note in the news release from the county that some students are refusing to disclose contacts. I'm wondering if you can elaborate to that, and is there any worry that students may not be completely honest about the contacts they've had?
Greg, do you want to start and then I'll add?
Well, I think the order from the county speaks for itself. You know, when they do contact tracing with a Grand Valley student, they're usually getting 1 or less contacts, and when they do it with someone else from the public, they're usually around 3 or 4. And part of that just may be understanding what exactly is a contact. And we're really doing a lot. We've really ramped up in the last day or so, and we'll continue to do that, is educating our students on the importance of contact tracing, the importance of isolation and quarantine, and adhering to those restrictions to contain the spread. And also, again, maybe to help them understand really what does a contact really mean? So that we can, again, we want our students to understand the importance of full cooperation with the health department to really contain the spread, because it's a multi-leg stool here that we're trying to do to contain the spread. Testing is a big part of it. Contact tracing is a big part of it. Isolation and quarantine when necessary is a big part of it. Mask wearing is a big part of it. And so we need all those things working together to have our most effective defense against containing the spread of the virus.
I just would want to add to that our students are also taking, our student leaders, an active role with peer-to-peer education around issues like contact tracing, and they're running some really exciting campaigns kind of from their own perspective on the importance to protect each other. And that's really additive too, because students really do respond very well to other students who are reminding and encouraging and moving them towards these requirements in every way, as Vice President Sanyal indicated.
Hi, Chad Livengood, Crane's Detroit Business. How many courses are in person, or what percentage of your classes are in person, or are you going to suspend any of those over the next 2 weeks?
No, we're not making any change to our in-person classes because we have no evidence that there's that the transmission is happening within the classroom. They're all socially distant. They're all below 17 in classrooms that hold 40 plus students. So we have really good controls. We have no compliance issues with students wearing masks in classrooms. So we will continue the in-person classes that we're offering. It's about 20%, and I can get the precise numbers to you, but it's about 20% that's face-to-face, about an additional 40% that's hybrid, and the remainder are fully online. The face-to-face hybrid mix weights more towards the younger students as they're making that transition to college, and the more fully online towards the older students and graduate students.
And also, during this lockdown, what type of on-campus facilities are remaining open, such as the library or cafeterias?
Yeah, all of our. Go ahead, Greg.
I was just going to say, again, it's a stay home. You know, it's not a lockdown. It's stay home, stay safe kind of direction from the county, but. You know, our library will remain open, food service will remain open, but keep in mind, all those facilities are already set up to be socially distanced. We've had a lot of furniture removed. The furniture we can't remove, we've shrink wrapped. We've done a lot of things. We've got stickers on the floor, so everybody knows how to stay socially distant. So those facilities will remain open, but they've already been set up to be socially distant to begin with.
If you haven't been to campus this year, I invite you to come. The density of our campus is dramatically down. When you start taking into effect, you know, the part of our workforce that is remote, the amount of our student learning that's online, the socially distanced facilities, there is a dramatic difference in the density of our campus to be preventative on COVID-19.
This order is for Ottawa County, but obviously you guys have the downtown Grand Rapids location. There are a lot of students who travel back and forth. How does this impact them, and how will that kind of be enforced for the students who commute campus to campus?
The order was from the Ottawa County Department of Health, and it's very specific about students that reside in Ottawa County. For those students that reside in Kent County and take classes in Allendale, they can certainly continue to do that. And students that live in Ottawa County that take classes that are in Kent County can do that. I mean, those are, you know, the exceptions to the stay-at-home direction include going to class, going to work, experiential learning, etc. So they'll still be able to do all of that.
And be mindful, the order is really focused on those, you know, those areas where students congregate socially, and it really kind of acknowledges that we're not seeing transmission in our university facilities, you know, busing, the kinds of places that you may also look for the virus to be at levels that are high.
Can you see why students don't want to tell on each other when they're doing contact tracing and that sort of a thing? Because it does, you know, it's an uncomfortable conversation to have with your friends, and how you're trying to kind of combat that.
Yeah, I mean, so many things about the public health guidelines we're all struggling with our comfort with. So of course, you're absolutely right. It is not the most comfortable conversation to be had, but we just have to keep reminding students that the stakes are high, that it's about protecting each other. And in this particular case, where it's a matter of, you know, everybody is going to be in the same condition in the Allendale community. So it just will help us as those tentacles reach out.
I would also add, you know, a few months ago, it was uncomfortable to talk about masks. And I think as in general, we've gotten past that. And I would like to think that we could do the same with contact tracing when we realize how important it is and how it is such a big part of our defense against the spread of the virus.
You mentioned that with mask wearing around outside and campus, the first step to remind students then there could be some action for repercussions. What could those look like, you know, if there is some groups of people congregating in some area on campus or shortly off? What could some of those repercussions be after, you know, some of that investigation?
Well, students are subject, and if you look at our code of conduct, we have addressed in our code of conduct specifically public health requirements so that it's not subject to interpretation. They're outlined in there. So virtually any discipline that could be made for student conduct violation can be made for perpetual disregard of a guideline. So it could mean anything from probation to suspension to expulsion. All of those things are possible. But again, we don't begin there. We begin with presuming that most people are struggling, as we all are, with the requirements and kind of life as we know it today. And that if we remind them and educate them, then we move very quickly and rapidly to the kinds of sanction-related issues that come with persistent noncompliance.
Is there a point, I know you talked about coming back and that you're not seeing contact tracing showing cases sprouting or stemming from in-person courses. Is there a step though is there a point that would change that maybe the university would look at doing more of an online only option for this semester or next semester?
Yeah, it's a really good question. And we did begin with what we called a 30-30-30 with our plan that 30% it would be face-to-face, 30% would be hybrid, and 30% with online. And we skewed more towards online based on the trajectory of the virus and based on the comfort of individuals to be in a face-to-face setting. So we can always see it possible to shift yet again, but the circumstances do not require it at the present time.
Also, we have a large part of our student population through pulse surveys that we do that really want the face-to-face experience.
So we have just a couple minutes left. Any final questions?
This is Ron French at Bridge. Greg, you had mentioned several times that this is not a quarantine, but I assume you do have some students who are in quarantine who lived on campus and tested positive. Can you give us a rundown on the number of students who are in quarantine, and if there's also a separate number who have been contact traced and are in some sort of isolation?
You are right. We have a number of people that are in quarantine, both on campus and off campus at their residence. I just don't have that number at my fingertips, to be quite honest with you.
You might get it.
Yeah, we've got 277 on the quarantine list, but I don't have that broken down on or off campus. I just don't have that number at my fingertips.
Thank you. And just a follow-up question on that. Your campus, as much as any in the state, has taken enormous precautions to try to keep the campus safe and to keep students safe. That being said, since mid-August, according to the county health department, you've had more than 600 cases. Is this, reflecting back, should we all have expected this, that there is just no way to keep this virus out of campuses when you're dealing with students who are naturally social?
Well, I think that we expected to identify cases. We had a very aggressive testing program. You know, we're only a couple of weeks away from repopulating, essentially. And so with our testing program, we expected to have cases. The number, I don't think we necessarily knew the number, but again, the key is to identify the cases, if you have them or not, and get those people isolated and quarantined to stop the spread. You know, we could have not done testing and our numbers would have been much lower, but we probably wouldn't be the safe community that we are right now. You know, if we were, like President Mantella said, you know, early on, we're not beholden to the number. We're beholden to keeping the campus safe. And the way we do that is to test people, get them even if they aren't showing symptoms, to find out what the asymptomatic spread could be. So yeah, we could have had much lower numbers without a testing program, but that just doesn't feel right from trying to keep the campus and the community at large as safe as we can.
The other thing I would add, and I think we all know this, is the virus it's not a 9-week or 9-month issue for us. It will likely be adjusting to new conditions over multiple years. And I think we can't presume that just shifting online relates to student populations identically. Some people have the readiness, some people can limit distractions for online learning. Some struggle and some don't struggle with college transition. So what we're trying to do is put the right safeguards, adjust midstream aggressively, quickly as needed, work with our community so we're not an accelerator, and keep learning happening. And I don't think it's a, you know, sometimes we talk about it, well, like you could easily shift. Not without some costs to student learning and to the experience and the talent this state needs.
And I would also add that, you know, we have 40 students that are taking nothing but online classes that have tested positive, and we count them, even though, you know, they're not coming to campus. So it's so being online isn't going to prevent students from getting the virus, because there's a classic example right there.
We've seen that among colleges and universities because students are committed to go and to have an experience, whether they are online or face-to-face. So we felt this was the most responsible action for our community.
You mentioned that sanctions have kind of been a last resort for the university. Are you able to disclose maybe the number of sanctions that the school has had to issue as a result of investigations into cases and students, or have there been any of those?
There have been sanctions, and I don't have the numbers with me at the present time.
Well, thank you all for joining us for today's Zoom news conference on behalf of President Mantella, Vice President Sanyal. Thank you for being able to join us.